Today's guest is Professor Dr. Snajana Tisheva, Professor of Cardiology at the Medical University of Pleven. It's been quite a journey, more than 40 years in cardiology. Thank you for joining us, Professor. What made you choose cardiology specifically?
Oh, I think that cardiology is one very logic science.
Okay.
That's why all of the areas of cardiology is very interesting. But maybe because the ischemic heart disease is very frequent and the people died from the coronary artery disease, that's why it's one of the first my focus. For example, in the uh, past, I worked in the Department of Intensive Cardiac Care,
Okay.
and that's why all the problem around reanimation of the patient I know perfect.
Okay. So, because it is one of the leading cause of death and it is logical science, as you said, you prefer cardiology.
Yes.
Every specialty has their rewards and struggle. As you practiced decades in cardiology, what do you think is the biggest struggle in cardiology and what do you love the most about cardiology? Your personal opinion.
Mm, I love cardiology. This is one emotional link, but this specialty is very difficult because it's necessary to know many facts, to check the patient very systematic, to know the technical methods for the examination, to make the conclusion when we start the diagnosis and the treatment. It's difficult but very interesting.
If a medical student is thinking to specialize in cardiology, what
Yes.
advice would you give them to acquire before graduating?
It have to know perfect anatomy and physiological specificity in the heart system, in the vessel system, because if they don't know the physiologically changes, it's not possible to understand the pathological changes. It's obligate the people who want to know cardiology, it's necessary to know the basic science very hard. When you make this decision, it's necessary to prefer your knowing and to be nearby cardiological center in university, not in the peripheral centers, because it's necessary to be the people which it's possible to educate these young people, to train, to be the leader in the teaching.
Okay, so you're saying to immerse full immersion of the student in the cardiology department other than just the textbook. Let's talk about the cardiological disease and its prevention.
This is one very important and very big area in cardiology, the prevention. But it's necessary to know the characteristic of the population, the population parameters. For example, it's know the main risk factors. In Bulgaria, the very important risk factors at first line is arterial hypertension. There is the specific function of the family history. The second line is dyslipidemia. The behavior is very important. The smoking is very, very frequently in our population. It's necessary to know this characteristic uh, uh, and to prevent any of the components. It's very difficult because this is linked with the knowing of our politics and the function of the cardiologist is to teach, to organize, but the social background is very important. It's necessary to young people to be with the high level of education, the conception of the physical training, of the manner of the eating, nutrition, it's very important. For example, in some area in our country, there is the people which use very high level of the salt.
Okay.
It's necessary to explain. But the behavior is very difficult to control. In our cardiological society, we have the plan to control the big risk factors for the health manner of the life. It's difficult, but we have the first steps in this duration.
Mm-hmm. You just mentioned about the modern lifestyle and the behavior, which are the leading risk factors for all this cardiological disease. What do you think about sleep and stress compared to the things you just said? How it is important in cardiological disease?
The sleeping is health, but it's not possible to measure the stress and the distress because there is different components. One part is acute stress.
Okay.
The other is chronic stress.
Yes.
The chronic stress is linked with the social condition. That's why when in our society not the hard reglement of the modus vivendi, the stress is very high. And the result is very low to control the stress.
Yes. As you just mentioned, I also observed personally the stress is a big factor also. People are going through chronic stress, especially our generation, and it is one of the leading factor for most of the disease along with cardiology and other modern lifestyle and sleep and all the other risk factors you mentioned. So what advice would you give to adults? Just 3 advice to protect their hearts.
The first is to arise the physical activity.
Exercise.
It's obligate. The second is to sleep very long. The sleeping for different people is enough indifference.
Exactly.
And the next, it's necessary to eat very healthy and don't use the drugs, the stimulators, because they make the deviation of the thinking and the regulation of the stress. The opposite of these factors is physical activity. The physical activity, the high physical activity, control the chronic stress, and it is possible to be healthy.
Okay, so all the basic things, exercise, sleep, and eat healthy.
Yes.
That can prevent you from many cardiovascular diseases. I want to talk about the future of cardiology. As technology arrived, modern imaging, artificial intelligence, and all the new innovations, where do you see the future of cardiology heading? And is it going to take over some cardiologists in some ways?
I think that the new technological results is very important in cardiology, but because it's possible to make the measure, to educate the function of the heart by this machine and this manner of thinking. But the basic data and the interpretation, finally, this is the function of the cardiological people, of cardiologists. That's why I think that in the future the develop will be head to head the people, the cardiologists, and the artificial intelligence.
What advice would you give to young medical graduates who are confused about their specialty? They feel insecure, inconfident, and they know which specialty to choose. What would be your singular advice to them?
The people choose that which know better. When the men know the specificity of the specialty, know better, and the interesting links is more, and it's necessary to choose this area which know better. When the student don't know specificity in this in some area, in any area, it's not possible to choose this. The education is very important, the basic education.
It comes to another question. What makes a cardiologist good cardiologist? What do you think? You have been in this department and you've been working as a cardiologist more than 40 years.
I think that it's necessary to be a good man and to like the people which is your patient, and this is the condition for the good cardiologist.
Okay, so it's not about the education and technique, it's about human being.
It is the other part.
Yes, it's the other part.
But the first condition is to be the good man.
If you can give one advice to your younger self when you came in the hospital as a cardiologist for the first day, what would be that advice to your younger self?
It's necessary to see and to heart 2 times many that's the other people.
Okay.
When the leader explain what is.
Okay. So to be very attentive listener.
Yes.
And understand what is your teacher
because
saying.
Understanding is the condition too for the rising of this specialist.
Okay. Professor Tisheva, it was very nice having you. Thank you for joining us.
The pleasure is mine.
Yeah.